64%. That's how fast unsheltered homelessness in the Bronx jumped between January 2024 and January 2025, the sharpest leap of any borough during New York City's annual Hope Count. The city tallied 4,504 people sleeping outside on a single winter night. The Bronx alone drove the surge. Yet, even as sidewalks turned into bedrooms, City Hall quietly inked a $929 million no-bid contract with the hotel industry, paying up to $352 a night per room to stash migrants and longtime New Yorkers in repurposed tourist suites. So the question isn't just why more Bronx residents are on the street. It's how nearly $1 billion can flow into emergency beds while the crisis keeps growing. Keep watching, because the numbers are staggering, but the money trail is even more shocking. 4,504 unsheltered New Yorkers is a citywide total, but drill down and the data screams. The Bronx's surface street count rose 64% in 12 months, while Manhattan actually dropped by 7. Families feel the blow first. On an average April night, more than 108,000 people slept in shelters, and 69% were parents and children. Behind every decimal is a lost paycheck, a rent hike, or an eviction filing. Court records show that in 2024, 1 in 4 Bronx evictions began over one missed rent payment, often triggered by a medical bill or unpaid day off work. When the Bronx's unemployment rate hovered at 7.8%, nearly 2 points above the city average, those slips turned fatal. Bronx sidewalks were never meant to house the population of a small city, but the borough's patchwork of underfunded mental health clinics and overcrowded shelters leaves thousands with nowhere else to go. And that perfect storm sets the stage for a spending spree that critics call a billion-dollar Band-Aid. Follow the money. In June 2025, the Adams administration extended a no-bid deal with the Hotel Association Foundation, $929.1 million through mid-2026 to shelter roughly 86,000 people, half migrants, half long-term homeless New Yorkers. Factoring in security, hotel staffing, and third-party fees, the nightly bill reaches $352. Critics note that's 3 times the median Bronx studio rent. City watchdogs are livid. A March 2025 NY1 analysis showed $3.5 million spent on encampment sweeps in just 9 months of 2024. Yet only 3% of those displaced accepted a shelter bed. Meanwhile, a Department of Investigation audit found that of 2,308 people swept the previous year, only 3 ever landed in permanent housing. Even FEMA is skeptical. After questioning paperwork, the agency froze tens of millions in reimbursements, and 4 city officials lost their jobs. Understandably, Bronx residents smell profiteering, especially when the same hotels once priced for tourists now line entire avenues with temporary no vacancy signs. But the hotel plan is only half the story, because when one shelter fills, the city opens another, often in the same few South Bronx neighborhoods that already shoulder the heaviest burden. Early 2025 brought word of a 2,200-bed mega shelter retrofitting a vacant IBM building near the Bruckner Expressway. Locals, led by Representative Richie Torres, blasted the plan. "The Bronx is being used as a dumping ground," he said at a January rally. Officials insist the tent cities on Randall's Island are closing and demand is falling. Paperwork tells another tale. Even after 13 hotel sites were phased out, more than 86,000 migrants and homeless New Yorkers still slept in hotels every night this spring. The mega shelter shuffle looks less like a drawdown and more like musical beds, one that pits new arrivals against families who've lived in the Bronx for generations. And when 2 groups with different languages, paperwork, and case managers compete for the same limited services, no one truly wins. City outreach workers, warn that caseload ratios in the South Bronx have ballooned past 1 to 70, double best practice standards. Families wait months for a single placement meeting, all while hotel invoices arrive daily at the comptroller's office. Housing costs continue their steep climb. The Bronx Rental Market Report pegged average apartment rents at $2,562 in June 2025, up 12% in a year and 56% since 2019. A two-bedroom in Mott Haven now averages $3,083. With a borough-wide median household income barely above $42,000, the math is impossible. A family must earn $103,000, more than double, to keep rent under the recommended 30% threshold. Vouchers offer little relief. City FEPS caps haven't kept pace with private listings, leaving recipients chasing units that vanish before paperwork clears. Landlords pocket hotel cash instead. $10,500 a month per room, courtesy of the city, trumps any voucher. Eviction filings tell the human side. Legal Aid's Bronx office processed 34,000 cases in 2024 alone. Court observers say the Rocket Docket now gives tenants 8 minutes to argue their case before default judgments push them toward shelter intake. One paralegal called it speed-run homelessness. When the roof goes, mental health is usually next in line, and the borough's safety net is threadbare. City Health's inaugural State of Mental Health report revealed that nearly 90,000 New Yorkers reported unmet addiction treatment needs in 2023, and the Bronx sits at the epicenter of opioid deaths. Field surveys of unsheltered adults in Morrisania and the Concourse last fall found 38% grappling with substance use disorders, mirroring police overdose data in The Hub. Yet low-barrier help is scarce. Mayor Adams's subway safety plan promised 500 new safe haven beds. 2 years on, only 350 exist citywide, and fewer than 240 operate in the Bronx on any given night. That is one bed for roughly 20 unsheltered Bronxites. Take Lena, a 47-year-old sous chef, sidelined by PTSD after a violent assault on the 2 train. She bounces between Pelham Bay subway cars and the emergency room. Sleep is rumor, she says. Intake officers gave her a 7-day hotel voucher that ran out before a therapist could call back. Her story isn't exceptional, it's average, a system where triage outruns treatment. Still, rays of community resilience pierce the gloom, proving that with targeted resources, people do rebound. On Willis Avenue, the purple-walled Oaxacan eatery La Morada transforms into a mutual aid kitchen every afternoon, ladling out 500 free meals to migrants and neighbors alike. Donations fund language classes, tenant rights workshops, and winter coat drives, services city contracts seldom cover. 2 blocks west, a coalition of bodegas and cafes hired 200 formerly homeless Bronxites through a 2023 small business grant. 70% were still on the payroll 6 months later, according to the Bronx Business Improvement District. Success on a shoestring contrasts with big-ticket hotel bills. Since 2022, the city has spent $3.12 billion on commercial hotel shelters alone. Advocates now fear those very nonprofits could see cuts as City Hall scrambles to offset hotel overruns. Early budget drafts flagged a $75 million reduction in community-based grants, enough to shutter dozens of food pantries and legal clinics. That irony isn't lost on Bronx residents who watch aid shrink while hotel contracts swell. Which begs the question, if grassroots prevention works, why not scale it up? Evidence says early intervention pays. The state's Emergency Rental Assistance Program has already funneled billions in arrears relief statewide, keeping more than 335,000 households out of court since 2021, according to an OTDA annual report. When rapid rent aid lands before the marshal's notice, Families stay in their homes at a fraction of hotel shelter costs. Combine that lifeline with living wage job training. The Bronx healthcare sector alone expects 9,400 openings by 2027, and the revolving shelter door begins to slow. Funding dozens more small, neighborhood clinics could shrink overdose deaths and hospital readmissions, saving both lives and money long term. Accountability must anchor every dollar. An independent audit, public dashboards for hotel invoices, and a 60-day cap on temporary sites would force city agencies to transition spending toward permanent supportive housing, construction that employs local labor while lowering future budgets. In short, prevention beats triage, transparency beats blank checks. The Bronx doesn't need another billion-dollar Band-Aid. It needs a stitched-up safety net. Bronx sidewalks can't remain the default bedrooms. If opaque contracts soak up resources while community fixes fight for scraps, next winter's hope count will dwarf this year's grim record. So here's the challenge. Demand transparency. Ask your council member why 352 hotel nights trump 2,500 apartments. Back grassroots work. Volunteer an hour, a skill, or $1 to groups feeding and hiring neighbors. Spread the word. Share this story, drop your ideas below, and hit subscribe. Every view nudges officials toward real solutions, because silence keeps the streets crowded. New York invented hip-hop, breakdancing, and street ball legends. It can also invent a city where no one has to sleep on a grate to hear the pulse of the Bronx. Let's push for that headline before the next hope count rolls around.